Welcome, everyone, to the Let's Talk About Medicare podcast with Les Young, your Medicare advocate. I'm Charlie McCracken, the media specialist for this podcast, and I work closely with Les to bring you valuable information about Medicare. Les is a chartered healthcare consultant with Trailblazer Benefits. His primary focus is to ensure that you understand how Medicare works so that you are positioned to receive all of the benefits that you are entitled to and all the benefits that you deserve. Hey, Les, how are you today?
I'm fine, Charlie. Thank you for asking. How about yourself?
I'm doing wonderful today. And I'm excited to have this conversation with you about the four basic parts of Medicare, which are A, B, C, and D. And I know
Wonderful.
people have a lot of questions. So, yes, go ahead.
Great. The Medicare foundational parts are A, B, C, and D, as you mentioned. And those parts each play a very important part in a person's Medicare journey. I like to refer to it because they're not sure just what they're going to use, how it's going to be affected, and above all, what the costs are going to be. So what I've focused on is, as an advocate, is how can I help someone understand the benefits, how the benefits are applied, how they can take most advantage of the benefits, and just where they might be able to save some money. Now,
Very
as we mentioned, Medicare Part A, that takes care of your hospitalization. That is something that you earn for just working in this country for 10 years. You earn each year four quarters. That's a quarter every 3 months under the Part A. And after 10 years, you've earned 40 quarters. Yes, 40 quarters. And that pays for that Part A. Now, under Part A, you can experience outpatient services such as rehab, inpatient services if you go into the hospital, and it's a very crucial part of Medicare. Now, imagine this. I have a client, Susan. She was in her late 60s, and she was enjoying her retirement when she suddenly experienced some severe chest pains. Now, she was rushed to the hospital and where she underwent an emergency procedure. Now, thankfully for Susan, she had Medicare Part A. That's something that, as I mentioned before, that she earned, which covered the majority of that hospital stay, including the surgery, the room, the board, and anything else that came up. Now, because Susan understood her Medicare coverage, she didn't have to worry about the financial burden while she was focusing on just her recovery alone. Now, Part A helps protect you from potentially high costs in hospital stays. And as you know, they can be extremely high, sometimes as much as $50,000 or even $100,000. It covers semi-private rooms. It covers meals, general nursing, and drugs, and some of the inpatient treatment. Now, while these costs for Part A are associated with deductibles and coinsurance, most people don't pay a monthly premium for the coverage if their spouse have Medicare taxes while working. Now, Medicare A is essential for your peace of mind when you are undergoing the hospital stay, but it's there to ensure that if you ever need it, you have a significant Medicare experience and you can focus on your health and recovery. Now, that's the important part. As we move to the next parts of Medicare, I want you to remember Susan's story. If you ever go into the hospital, being informed and prepared can make all the differences in a challenging time.
wonderful, wonderful. Good for Susan. Let me ask you. So, I understand that Medicare Part A is the part that covers hospital, skilled nursing facilities, right?
Correct.
Hospice and some home health care.
Correct.
So if a client needed to use another part of Part A, how would they do that? How would that work for their plan for like a nursing facility or hospice or home health care? How would that work?
Well, again, that's covered under that Part A. And all of those procedures will follow the Medicare policies or rules that they have for the deductible, the co-insurances, or the co-pays. So you do have the coverage there for the Part A, but now Part B is just a little bit different. And that is something where we get into doctors, and then we're talking about outpatient services and things like that. So let's talk about that just a little bit. The Part B. That covers the doctor's visits, preventive care, some of the medical supplies, and it is one of the foundational parts. You just want to keep that in mind. And here's another story. Now, this is John. Now, John was one of my clients. He was healthy, but he was in his early 70s because he had been experiencing some symptoms in his 70s of maybe chest pain. Well, John's doctor began to run some tests that eventually diagnosed that if left untreated, he would have some serious health problems. Thanks to the preventive services covered under Part B, they were able to see in advance and avoid worsening conditions, worsening situation. So Medicare Part B covers things like, as I mentioned, the doctor office visits, lab tests, surgeries, and even physical therapy. It also covers the preventive services like the screenings, the vaccines, and those monthly premiums for Part B you will experience, and it's going to change depending on what your income is. So that's another part of Part B that we'll get a chance to talk about maybe later on. But know this, the benefits far outweigh the costs when you take on Part B, especially when it comes to catching health issues early. Now, John's story is a great reminder of how important it is to stay on top of your health. Now, that's the preventive. Preventive is very important. I'm a big advocate for preventive services. If we catch it before it happens, then we stave off a catastrophic event that could happen later on in life. So Part B gives you the tool to do just that, and it's an everyday medical needs for healthy and active lifestyle. As we continue to think about how this part of Medicare helps you take charge of your health and your well-being, we're going to talk about something else. There is another option, and that's Part C.
Well, let me ask you. I understand that Part C is the Medicare Advantage plans, and there's so many of them. We see so many ads and everything. It's so hard to tell what choices to make. So, but my question is, why is it considered an alternative to the original Medicare? What's the
Great
difference?
question. Well, that's a great question. As you know, original Medicare was started back in 1965. We don't have all the advances in the technology that we have today. We don't even have the same lifestyle as we did well over 60 years ago, back in 1965. Well, that being the case, Medicare Advantage gives you an option of how you receive your health care. It's something that's offered by private insurance companies, but of course, it's regulated by Medicare. Those private insurance companies are only allowed to participate with the Medicare members based on their performance, and if they're meeting at least what original Medicare provides. For example, a company like Humana or Aetna or Cigna or United Healthcare, any of those big four that we well know about, they must meet Medicare's original type of plan rules and policies in order to participate. Now, because it's an option, it means this. There are some additional benefits that you can get because original Medicare didn't have dental, didn't have vision, didn't have hearing. But you do get that through a Medicare Advantage plan that provides these extra benefits. Now, because these are offered through, as I mentioned before, private insurance companies, they can charge, in some cases, different premium costs. Some of them, and most of them, are at zero cost. And I say zero cost, meaning that you're not paying anything in the way of a premium, but you are paying through your Part B cost premium that you get through original Medicare. So every person must have that Part B premium, even to participate, whether it's original Medicare or if it's a Medicare Advantage plan, which is the Part C. You've got to have that Part B premium. And that's something that people today are learning, in some cases, the hard way, because that cost can vary. And today, it's based on whatever the cost of living is, also whatever your line 7 1040 income tax report shows. So that's an interesting fact about the Part B. But we can get into that later. Some of the advantages again: dental, vision, hearing, fitness, and preventive care. And you even have some options where you get healthy benefits or help with paying for some of your costs, like maybe your electricity, if you're on a fixed income, maybe your gas bill, maybe even getting healthy foods. So some of them have extended those benefits even beyond that. So that's something to keep in mind when we look at Part B. Now, again, original Medicare did not have these things back in 1965. So that's one of the reasons why they call it the Medicare Advantage plans.
Got it. Because I have a Medicare Advantage plan and I didn't fully understand um, why it was so cheap or why it had so many good benefits, because it does have a fitness component. It also has a nutrition component where I'm allotted a certain amount of money every quarter to buy healthy foods. And it's just fruits and vegetables and meats and, a few things like that. But it's those essential things that are for, maintaining a healthy well-being. And also I get glasses. Every 2 years I get a pair of glasses, which is nice. Because a lot of us, as we're getting older, glasses are very, very expensive. So
Exactly.
I do appreciate my Medicare Advantage plan that I have through my insurance company. Well, finally, let's talk about Medicare Part D. And this provides, from what I understand, your prescription drug coverage. And as you know, Les, this is very important because we are known as a country that really partakes in prescription drug use. So, how important is that part of the Medicare program?
That's a critical part. Now, the Part D prescription drug plan wasn't always around. It
Mm.
actually just came into being around 2003, 2004 under the Bush administration. Now, could you imagine being, as you mentioned, a nation that uses a lot of prescription, and we have a lot of people who are on either heart medications or high blood pressure medications, or even prescriptions that are designed to help with Alzheimer's or Parkinson's disease and cancer. A lot of these prescriptions are extremely expensive. Just imagine if we didn't have a prescription drug that allowed us to pay a portion of the cost through a copayment or co-insurance or a deductible, rather than having to pay the entire cost of a prescription. So the
Right.
prescription drug, again, is very critical. And the reason I say this is I remember working with Bill. Now, Bill was a client who was diagnosed with diabetes, and he was in his mid 60s. Now, fortunately, Bill had enrolled in Medicare Part D, and with it, he was able to get his diabetes medications. Now, if not, he would have struggled to pay for things like insulin, for the strips, and things to measure and make sure that the blood sugar didn't rise so high that it was threatening a life-threatening a situation. So Medicare Part D, as you know, plays a very important piece with that. But what's even more interesting is beginning next year, we're going to have a limit on out-of-pocket costs for your prescription drug coverage. So
Wow.
that's wonderful news. At one point, there was something called the donut hole. It was a feared situation where someone who was using maybe a lot of drugs, they would enter this situation after they've met the first deductibles. Okay, they would enter something called the donut hole. And in that donut hole, they were responsible for the majority cost of those drugs. So no longer were they just paying 25% of the cost. They were paying more like a 90% cost of the drugs. So what has happened now is we've reached a point where the prescription drug plans are becoming much more efficient, much more affordable. And so this is something that I like to pass on to my clients to let them know that moving forward, beginning in January of 2025, you're going to see a great reduction in your prescription drug costs. More information to come on that.
Great. Great. Well, thank you so much for giving us the basic information that we need to understand about Medicare Parts A, B, C, and D. And I thank all of you for tuning in today. We realize there's a lot to learn about Medicare, and we're prepared to bring you more great videos just like this one. So I encourage you, visit the Trailblazer Benefits website for more information and just to connect with Les. If you have any questions, drop them in the comments below. And if you have not done so already, like this video and share this video and subscribe so that you won't miss any of our upcoming videos, because there's a lot going on with Medicare and with health insurance in this country. And as you know, when you are approaching the age for Medicare, you are bombarded with paperwork and documentation. And I know for myself, it was very hard to understand what it all was and how to make those choices. That's why you need an advocate like Les to be on your side to make sure that you can maximize your benefit experience. So that's all that we have for you today. Thank you for tuning in for the Let's Talk About Medicare podcast with Les Young. And we'll see you next time.